Hello, my name is Shahir Rashid and I am student of GMM 16. My today's topic is drugs affecting on male reproductive system. First, I will tell you about drugs affecting on male reproductive system, and then I will explain about female reproductive system. Okay.
Drugs used to affect the male reproductive system are male steroidal hormone or androgens. They act like testosterone development of male sexual characteristics, male sex hormone or anabolic steroids, synthetic testosterone preparations that have more anabolic effect than androgenic effect, and their tissue building. After that, drugs to improve the penile dysfunction. Now there are in the diagram sites of action of drugs affecting the male reproductive system are shown. Signs and symptoms of adverse effect of androgen or anabolic steroids. First one, swelling in the fingers or legs, continual erection, uncontrollable sex drive, yellow skin, fever, chills or rash, chest pain or difficult breathing, hoarseness, loss of hair or growth of facial hair in women. Next, androgens and their indications. Testosterone, also known as Duratest, testosterone mothers, it causes hypogonadism or breast cancer. Donazole, dinocrine, it is used to block the release of follicle stimulating hormone and luteinizing hormone in women. Flixomesterone, halotestin, it is a hypogonadism and breast cancer. Testoglactone, Teslac, it is also used to treat the breast cancers. Now, adverse effects of androgens: flushing, sweating, vaginitis, nervousness and emotional liability, headache, dizziness, sleep disorders and altered electrolytes. Then there is drug laboratory test, it is thyroid function and then for keratinine. More adverse effects of steroids, anabolic steroids, are cardiomyopathy, hepatic carcinoma, personality changes, sexual dysfunction, virilization and inhibition or testicular function, gynecomastia, testicular atrophy, priapism, baldness and change in libido. Now there is the anabolic steroids and their indication. Oxandrolone, oxandrine, it is used to promote the weight gain in tabulate patients. Then that is also used for increased protein anabolism, also used for treat certain cancers. And there is oxametholone, also can be called as Anadrol-50. It is used to treat the various anemias. Now the drugs approved for the treatment of the penile erectile dysfunction. First one drug is alprostadil, also known as Caverject mousse. Prostaglandin that relaxes vascular smooth muscles and allows the filling of the corpus cavernosum when it is injected directly into the cavernosum. Then the second drug is sildenafil, also known as Viagra, Tadalafil, Cialis and Vardenafil Levitra. It is used to selectively inhibit the phosphodiesterases type 5 receptors PDE5 and increase the nitrous oxide levels, allowing the blood to flow into the corpus cavernosum. It's adverse effects of the drugs that are used for penile dysfunction. First, edema. It shows the further the explained adverse effects. First one, edema, headache, dizziness, syncope, angina, dyspnea. Drug-to-drug interactions are PDE5 inhibitors combined with organic nitrates or alpha blockers. The things they can cause are dangerous cardiovascular effects including death, and other one, careful patient teaching is essential in this situation. Drugs for treatment of penile erectile dysfunction and their actions and indications. Actions are following: alprostadil injected and acts locally to relax the vascular smooth muscles and promote the blood flow into the corpus cavernosum, causing penile erection. It also inhibits PDE5 receptors, leading to the release of the nitrous oxides, which activate cGMP to cause a prolonged smooth muscle relaxation, allowing the flow of blood into the corpus cavernosum and facilitating erection. Indications for this are treatment of erectile dysfunction in the presence of sexual stimulation. Now I will tell about the drugs affecting female reproductive system. This is the site of action of the drug affecting female reproductive system. Drug used to treat disorders of the female reproductive system are as following. First one, estrogen and progestins, estrogen receptor modulators, fertility drugs, oxytoxics, abortifacients, and ocoilates. First one, estrogen. Its actions are protecting the heart from atherosclerosis, retaining calcium in the bones, maintaining the secondary female characteristics. Indications for the estrogens are hormone replacement therapy (HRT), palliative and preventive therapy during menopause. Cautions for the estrogens are breastfeeding, metabolic bone disease, renal insufficiency, hepatic impairment. The adverse effect of the estrogens are GI tract and can also be cause systemic effects of estrogens. Drug-to-drug interaction of the estrogens are drugs that enhances hepatic metabolism and corticosteroids. Side effects of estrogens are shown in this diagram. Estrogen receptor modulators are further explained as contradictions. Non-allergy, pregnancy, and lactation can be caused by them, and also patient with history of venous thrombosis or smoking. They are contradicted to use this. Next, there is adverse effect. It can cause the upset of the GI, gastrointestinal tract, changes in fluid balance, headache, dizziness, and visual changes. Estrogen receptor stimulation, hot flashes, skin rash, edema, and vaginal bleeding. Progestins are the others. First of all, their actions they transform the proliferative endometrium into the secretory endometrium, inhibit the secretion of FSH and LH, prevent follicle maturation and ovulation, inhibit uterine contractions. Indications for progestins are contraception, treatment of primary or secondary amenorrhea, fertility protocols. Next, there are pharmacokinetics, well absorbed, undergo hepatic metabolism, and are excreted in urine. Fertility drugs. The action of fertility drugs are directed by stimulating the hypothalamus to increase FSH and LH levels, leading to ovarian follicular development and maturation of ova. Indications are in fertility in men and women. Pharmacokinetics, they are also well absorbed, undergo hepatic metabolism, and renal excretion is occurred by them. Fertility drugs adverse effects are increased rates of multiple births and birth defects, ovarian overstimulation, headache, fluid retention, nausea, bloating, uterine bleeding, ovarian enlargement, and gynecomastia. Oxycytosis. Their adverse effects are most common, that are excessive effects, uterine hypertonicity and spasm, GI upset, also called the nausea, headache, blood pressure changes, water intoxication. Thank you so much. And this was all for today.